this because of the memory of Frederick Banting, the great scientist who discovered insulin, and so many other scientists whose research activities has given us so much light and so much knowledge in controlling these complications of diabetes. So diabetes is the #1 threatening killer of the chronic diseases. Along with this, so many other diseases are there. आज हम आप आपसे 1 घंटे के लिए we'll discuss on various aspects of the theme which is on World Diabetes Day, which is focusing on the complications and diabetes and wellness. So I'll just share the screen and show the program which we are doing today. I think you can see the screen. I'll just make it full screen. Yeah. So I think we are all knowing this program. And today we have got along with me Dr. Sanjay Sharan, who is the moderator. Dr. Sanjay Sharan is the Associate Professor of Endocrinology at SMS Jaipur. Welcome, Dr. Sanjay Sharan. Along with us, we have got an expert lineup. We'll discuss different questions with them. We have Dr. Narendra Kotwal, Dr. P.K. Jabbar, Dr. Sanjay Badada, Dr. Kaushik Pandit, Dr. K.V.S. Harikumar, Dr. Deep Datta, Dr. Sheila Sheikh, Dr. Saptrishi Bhattacharya, Dr. Gagan Priya, Dr. Santosh, and Dr. C.V. Sinagej from all on discussing diabetes, various aspects of diabetes. So before much ado, let me welcome our President, Lieutenant General Dr. Narendra Kotwal, who is Director of Endocrinology at Paras Hospital, Panchkula. He recently gave a brilliant talk at the ESICon 2024 at Vizag, focused on environmental endocrinology. Besides that, he is interested in spiritual and geriatric endocrinology with more than 100 publications. As I stop sharing the screen, may I request the audiovisual team to please play out Sir's recording.
Good evening, everyone. Today on World Diabetes Day, as part of initiative from Endocrine Society of India, we are trying to create awareness. Let us shine a spotlight on diabetes and inspire action that can improve lives, one step at a time. Diabetes is more than a health condition. It is a daily commitment, a journey that requires understanding, awareness, and resilience. Today, millions of individuals and families worldwide are impacted by diabetes, a condition that with the right resources and support can be managed effectively. Our message this year is about empowering lives, making informed choices, ensuring equitable access to healthcare, and promote health and wellness, embracing preventive measures that can change outcomes, from balanced nutrition and consistent physical activity to regular screenings and responsible medication management. We have the powerful tools at our disposal to fight this condition. Together, we can aim for a healthier tomorrow by raising awareness. Knowledge is a power. By sharing information about diabetes, we can help reduce stigma and provide crucial support to those managing the condition. Promote healthy living. Prevention is essential. By encouraging healthy dietary resources, regular exercise, and lifestyle modifications, we can reduce the risk of diabetes and improve overall health. Support early diagnosis and access to care. Early intervention can make a profound difference. Let us advocate for better healthcare policies, affordable treatments, and access to essential medications for all. Encourage well-being. Diabetes is not just a physical, it also affects emotional health. Let us build a compassionate community where those affected feel seen, heard, and supported. On this World Diabetes Day, let us pledge to make diabetes management and prevention a collective priority. By doing so, we can create a world where diabetes is no longer a barrier, leading a full and vibrant life. Through unity, compassion, and sustained effort, we can make a difference and bring hope to millions. Let us continue this journey towards a future where everyone has tools and support to live healthily and thrive beyond diabetes. Thank you very much.
Thank you very much, Kotwal sir, for that brilliant message. So this is a very important to know that the theme is actually on diabetes and well-being. So my first question in this panel discussion is to Dr. P.K. Jabbar regarding what this theme really means and what can, as endocrinologist, we can understand about this theme. So I'll just share Dr. Jabbar sir's CV 1 second. As you all know, sir just completed his tenure as the ESI president. He is a professor and head of endocrinology at the endocrinology department, Government Medical College, Trivandrum. He is a brilliant postgraduate teacher. He is a director and CEO of Indian Institute of Diabetes, Trivandrum. He has also conducted the ESICon 2017, and he is the vice president of ITS and president of RSSDI Kerala. So may I request the audiovisual team to please play sir's pre-recorded message.
Good evening, my dear friends. President of Endocrine Society of India, Dr. Narendra Kotwalji, my friends in Endocrine Society of India, friends, ladies and gentlemen. I'm extremely happy to address this audience on this day of World Diabetes Day. You know, if you see the in-depth data published 1 year back, the prevalence of diabetes mellitus is rocketing, is touching around 11% in India. But if you see the data from certain parts of our country, especially Goa and Kerala, the percentage is very, very high. So I think that satisfies the diagnostic criteria of diabetes capital. There is no doubt. So I think, say Endocrine Society, very, very vibrant association, professional forum, fighting against these lifestyle diseases. But the result is not very good because of many, many reasons. Probably patient-related issues, disease-related issues, or physician-related issue. We can correct the physician-related issue, but disease-related is difficult to correct, but still you can modify or modulate. And patient-related problems. Still, if you see the data, a good number of patients are not following the treatment as we advised. And exactly that's what is reflecting in the glycosylated hemoglobin value of these patients. My dear friends, what I want to tell you that is high time to intervene and combine effort of vibrant society like Endocrine Society of India, governmental agencies, non-governmental agencies to reduce the prevalence of diabetes mellitus. Otherwise, you are going to see very unhealthy population in our Maha India. There is no doubt about that. So we, Endocrine Society of India, and we doctors, members of Endocrine Society of India, we should be very active and we should educate the people for reducing the burden of disease. And moreover, we are doing a lot of screening work, screening camps. Not only screening camps, we should look into the complication profile also. For that also, we should do some sort of screening. Then we will achieve the classical, the theme of Diabetic Day. And definitely people will get really benefited and will get a very positive health mentally, physically. There is no doubt about that. May God bless you. Best wishes. I'm signing off for the time being. Thank you very much. Ritika.
Thank you, sir, for that brilliant message. So may I request Dr. Sanjay Sharan to please take over?
Yeah, thank you, Mohan. So now I'm just inviting Dr. Sanjay Badada for my next question.
Barada sir, CV is placed here.
Yeah,
so
Dr. Sanjay Badada, he doesn't require any kind of introduction. As we know, he's the professor and the head of the Department of Endocrinology, PGI Chandigarh. A lot of achievements are there with his name. He was the previous president of Endocrine Society of India, received prestigious mentorship award by Endocrine Society of US and received the ECTS Clinical Research Award by the European Calcified Tissue Society 2024. So he has the many of the awards with his name. He is particularly known for the work on the bone and minerals. So now, the question to Sanjay Badada sir. Sir, actually in this era where almost 10% of the adult population of the world is suffering from diabetes mellitus, so where there a lot of urbanization is going on and, a lot of stress, whether it is mental stress, particularly maybe due to financial constraints or some other regions, particularly in developing countries. So how does this mental health influence the control of diabetes mellitus overall and overall well-being, how this mental stress control, please?
So thank you, Dr. Sanjay, and for the nice introduction, and the Endocrine Society of India for this opportunity, and very good evening to all the viewers. So the stress is not only important for the control of blood glucose, but stress can be an important factor to cause the diabetes. And one thing what we know in endocrinology is the only one hormone which is reducing the blood glucose, that is insulin. Otherwise, all other hormones in our body is working to increase the blood glucose level only. So whenever there is a stress, there is a fight and flight phenomena. And the fight and flight phenomena is associated with secretion of the various stress hormones like adrenaline, like glucocorticoids, like glucagon. All these are actually the stress hormones. And when there is a stress, these hormones are released, and we know that these hormones are going to increase the blood glucose to meet the emergency and exigency of that period. So that's why, and we know that one term we do use is that stress diabetes, because many patients, those are admitted in the hospital, they are not actually knowing to have a diabetes, but during the stress they develop the diabetes. So stress can cause diabetes, and stress can impair the blood glucose level by inhibiting the insulin secretion and by causing the insulin resistance. So stress, to mitigate the stress, is important part of the management strategy to control the blood glucose.
Yeah, very well elaborated by sir, that many, particularly these are the hormones which plays a quite pivotal role here to either aggravate stress or control the stress. So blood sugar is directly related to the stress because of these are various hormones which causes the stress, or they are increased during the stress period to cope up with the stress. So they causes the dysglycemia. So it is very well elaborated. So the next question to you, how the overall well-being is affected by this mental health of the particular population?
Yeah, so there is a famous saying that WHO health, what is health? So in the health, they include an important parameter that patient should be physically, mentally healthy. So stress makes the people mentally unhealthy. So even WHO definition clearly mentions so that if the mental health is not good, then well-being is always not good. And we know that in patients of diabetes, a significant number of population is having depression and the anxiety. The depression is mainly because of the multiple reasons. Any chronic disease can cause depression. In addition to these, associated comorbidities can lead to the well-being is poor because of this chronic complication, and many a time because of the loss of organ, like in patients of diabetic foot, the amputation is not uncommon. And on the top of that, the money or the required to take the treatment itself is very costly, and this is a lifelong treatment, everyday treatment, so that can also cause the stress. And so that's why this well-being is affected in diabetes because of the multiple factors. And probably because of this reason, this year the World Diabetes Day theme itself is the well-being in diabetes, probably. So that's why it is very, very important one.
Thank you, sir. Thank you very much. And we are fortunate enough to have you here on this platform on this Diabetes Day. Thank you very much. Now over to Mohan.
Yeah,
thank
you. Thank you, sir. Taking it further, we have got the next person who I want to interview. He is none other than Dr. Kaushik Pandit, sir. So Kaushik Pandit, sir, is actually the next president. That is the president-elect of the ESI. Hello, sir. How are you, sir?
Good evening.
Sir is
Thank you very much.
sir is working at the chief consultant endocrinologist at Wellbeing Clinic, Kolkata. He is also research scientist at Department of Endocrinology at IPGMER, Kolkata, with more than 50 publications in the national and international journals and many books as well. And his research is focused on two important aspects of areas in which we are today focusing, that is type 1 diabetes as well as the fibrocalculous pancreatic diabetes. So I think it is important that sir addresses a question which is going to come up. That is, what are the strategies, what individuals living with diabetes, what should they do to counter this stress, mental stress which we are going through, and how we can cope with the diabetic distress? Is there a term called diabetic distress? How we can do it, sir?
Good evening to all viewers. It's indeed, I think it's a privilege to be part of the team of Endocrine Society of India, which is at the forefront of the management of all endocrine diseases, including diabetes. So diabetes is a very important, probably the most important endocrine disease, most common endocrine disease that we come across. So it's little wonder that Endocrine Society of India will take lead in celebrating this very important World Diabetes Day, like every year, this in 2024 as well. The IDF had given us a theme of diabetes, and wellness. And if diabetes is not associated with wellness, then people with diabetes are certainly at a disadvantageous state, as propounded by my previous speakers, Dr. Kotwal, Dr. Jabbar, and very importantly, Dr. Badada. So I'll spend a few minutes on how we can mitigate this problem of this diabetes lack of wellness. So, or rather, we can say that coping with diabetes distress. This is a state of emotional burden and stress related to managing diabetes. It might be the metabolic aspect of it, maybe a financial aspect of it, or it is the social aspect of it. Now, how best to address this problem and come out of this diabetes distress? I would say a few points. The first point may be seeking support. It is better that you talk to a healthcare professional, discuss your concerns with your doctor, diabetes educator, or a counselor who can provide guidance and support. We can join a support group, which is not very common in our country, but available in most other countries. Connecting with them who have got diabetes can provide a sense of community and understanding. You should involve your loved ones, especially in your family, to share your feelings and challenges with trusted friends or family members who can definitely offer some encouragement. The next point we can think of is focusing on emotional health. It is important that we practice mindfulness and relaxation techniques. Meditation, deep breathing, or yoga can help at times. Acknowledge emotions, accept that feelings of frustration or sadness are normal and not a sign of failure. And consider therapy. A cognitive behavioral therapy may be needed at some point of time, where it can be in a very helpful state to address very negative thought patterns. The third thing that we must give credence to is improving the diabetes management skills in the first place. It is important that you set realistic goals, breaking down diabetes management into achievable bits of steps to avoid feeling overwhelmed. Educate yourself, and this probably is setting this realistic goal is probably the job of the treating physician. It is important that we educate ourselves as patient. Understanding diabetes and its management can boost the confidence and reduce the anxiety. Working with a care team is also very important. The fourth very important part would be adopting a healthy lifestyle habits. It is important that the management of diabetes, be it type 1 or type 2, focuses on lifestyle changes, following a balanced diet, focus on eating nutrient-rich foods that support blood sugar control and overall health. Stay physically active, go on regular exercise, managing blood sugar, but also improve the mood and reduce stress. Get enough sleep. Sleep medicine is now a very important aspect of the treatment paradigm. Prioritize sleep hygiene to avoid fatigue, which can exacerbate the distress. Fifth, the very important aspect of the monitoring and adjusting expectations. We must be very practical in accepting imperfection. Understand that no one manages diabetes perfectly all the time. Focus on progress, celebrate small successes rather than dwelling on setbacks. Be patient, Coping with management skills improve with time and practice. Sixth, it is important to build a routine, create a structure, establish consistent times for meals, medications, meditations, and physical activity. Use tools and technology. There are plenty of apps which are available these days now. Varieties of glucose monitors or sometimes planners can also help you simplify diabetes management. Seventh very important aspect would be addressing specific stressors. Identify triggers, which is making your diabetes control haywire. Reflect on what aspect of diabetes cause the most stress, such as fear of complications, financial concerns, or social challenges. It is important to problem solve proactively, work on the practical solutions for these stressors with the help of the professionals or support networks. And the next one, that very important step, the eighth step, I would say, take breaks when needed. Shift focus temporarily. Engage in hobbies, spend time with loved ones, or take a short vacation. And remember, going a little away from your target may not mean a failure. And coping with diabetes distress is actually an ongoing process. If feelings of distress persist or worsen, it is essential to seek help from a mental health professional specializing in chronic illness on diabetes care. I hope this short discourse helps many people who are at a disadvantageous position of diabetes distress. Thank you very much.
Thank you, sir. So we'll go for the next round of questions. For this, let me welcome Dr. KVS Harikumar, sir. Sir is the Secretary of ESI. As you know, sir has been with the ESI and he has been a lot of publications as well, 210 publications in peer-reviewed PubMed Index journals, and also Editor-in-Chief of International Medical Journal. He's a very good researcher as well as he's won orations and awards. May I request Sanjay ji to please engage, sir.
Yeah, thank you, Mohan. So now, as we know, Dr. KVS Harikumar, sir, he's the secretary and he's very humble man. And previously, we used to ask the question only president. So now we are asking the question to the secretary of Endocrine Society of India. So we know that in this era, whenever the person diagnosed with diabetes mellitus, so he feel very bad or he just get isolated from the society or other people's himself. Is feeling depressed or in this era of nuclear families and many more things, we see that many of the people's IT personals or other peoples are living alone from the family to earn something for the family or to just get the money for their daily living. So in this era of this kind of thing, we know how crucial support from the community of individual living with diabetes. So how the community can support the individual with diabetes?
Thank you, Dr. Sanjay, for that, I would say, interesting question. Good evening, everybody. First, I would say thankfully for diabetes. Even if you say that you are a diabetic in the community, it is not, you're not going to be an odd man out because it affects almost 10 to 15% of population. So rest assured that everybody whom you know either has diabetes or is on the verge of developing, or he would have a relative who is having diabetes. So that stigma associated with a particular disease is definitely not there, number one. Number two, if you look at it, the community support within the home and outside the home, if you look at it, somebody who is diagnosed with diabetes, maybe a spouse will obviously make some corrections. This also will help the entire family within the home and even outside subsequently, which will help in bearing that. Second, you will have some of those people who have already lived with this disease for 30 years, 40 years and leading happy, healthy life. So in the community, you have plenty of such examples. So they are the ones who will guide these persons that, look, just having diabetes doesn't stop you from getting anything or doesn't limit or impede any of your routine. You just have to take care of the disease. The disease will not trouble you. There will be a regular screening, regular monitoring or whatever as per the local endocrinologist, whoever is treating. But issue remains that as long as you're vigilant about your controls, complications and lifestyle measures, the diabetes generally doesn't trouble or affect the organs. So that is also important whenever we educate the patient. Some of the things when we look at and explain to these patients that their quality of life is not affected, their routine is not affected, the longevity is not affected, then that is the time they actually pay attention to it. The problem comes whenever we are giving more negative messages that it happens like this, it hasn't like this. It is important to educate them that if you control well, you are going to actually live a healthy life. If you don't control, that is the time you are having a problem. So in that sense, community will have lot of support groups, support systems, even within the relatives, friends. That entire circle will be there to take care of the individual, to help him or her in the journey with diabetes. Thank you.
Yeah, thank you, sir. Thank you very much for answering this question in this beautiful way. So you have just cleared all the things. Even many times the patients are coming to us for the asking that whether we can take the sweets or not. So we are saying that you are in the majority part, because now you will get the sugar-free sweets more than the normal sweets now, because you can afford, and the affordability is the big problem, because diabetes we see only mainly in the richer population. So on the healthy population, richer population. So now moving to the next question, over to Mohan.
Yes. So let me just welcome the next panelist, who is Dr. Deep Datta. He's young and dynamic. You can see he is working at Cedar Super Specialty Center in Delhi. He is having a lot of research, more than 235 publications in index journals. So I think the number of publications are going up with each panelist. That's what I can feel now. And H-index is also good. He's a member of EC in various associations. He's a joint secretary of ESI. Welcome, Dr. Deep. So the question to you is definitely the evidence which you can show on how nutrition can help people with living with diabetes have an enhanced well-being. So कैसे जो मरीज diabetes, because we are telling Hindi also, because we are going on Facebook as well. So कैसे हमारे मरीज लोग जो diabetes से बीमारी से जूझ रहे हैं, उनको कैसे उनका nutrition के इलाज important होता है?
नमस्कार डॉक्टर मोहन जी, सत श्री अकाल। टुमारो कल हम सेलिब्रेट कर रहे हैं गुरु पूरब। तो हमारे समाज में त्योहारों को अच्छे से मनाया जाता है। तो अगर हम न्यूट्रिशन भोजन के बारे में बात करें तो त्योहार के टाइम शुगर के मरीज काफी टाइम अपने आप को वंचित महसूस करते हैं कि घर में तरह तरह के पकवान बन रहे हैं, क्या वो खाए नहीं खाए। तो कौशिक पंडित सर ने कहा कि ये भी एक डायबिटीज डिस्ट्रेस या बेचैनी या मानसिक तनाव का कारण हो सकता है। तो जब हम मधुमेह या शुगर की इलाज करते हैं तो उसमें समझना कि इलाज एक व्यक्ति का नहीं, पूरे घर का होता है, पूरे घर के रसोई का होता है। अगर हम घर के खान पान रहन सहन को सुधारे तो ना ही जो व्यक्ति जो मधुमेह से जूझ रहा है उसके शुगर कंट्रोल में हमें आसानी होगी, बल्कि हम घर के जो बाकी जो मेंबर्स हैं उनमें भी हम शुगर से उन्हें दूर रह सकते हैं। तो अगर हम भोजन या न्यूट्रिशन के बारे में बात करें, खासकर मैं दिल्ली से बोल रहा हूँ, यहाँ शुगर और मोटापा दोनों चीज साथ चल रही है। तो जो लोग दुबले होते हैं उनमें शुगर होने को कंट्रोल करना मुश्किल होता है, बट जो मोटे होते, वेट ज्यादा है, अगर वो अपना वजन घटा ले तो उनकी शुगर की दवाई कम हो सकती है। कभी कभी कुछ दिनों के लिए, कुछ महीनों के लिए, क्या पता सालों के लिए छूट भी जाए। फ्रांस से आए, कोई भी भाषा बोले, एक चीज जो हमें यूनाइट करती है वो है हमारा प्यार, लगाव कार्बोहाइड्रेट्स या मीठे के प्रति। तो हमें डाइट में, घर की रसोई में, ना ही उस व्यक्ति पेशेंट के लिए, घर में सभी के लिए डाइट में कार्बोहाइड्रेट या स्टार्च या मीठे का सेवन हमें कम करना है। बहुत लोग समझते हैं कि शुगर के पेशेंट को कम खाना चाहिए, वो भूखा रह जाता है। ये अंधविश्वास है। शुगर के पेशेंट को भूखा रहने की जरूरत नहीं, उसको आधे पेट या खाली पेट सोने की जरूरत नहीं, बट उसे सोच समझ के लेना है। डाइट में प्रोटीन की मात्रा बढ़ानी है। तो प्रोटीन वाली चीज अगर हम देखें तो जैसे दाल की सेवन में लीजिए, अंकुरित चीजें जैसे स्प्राउट्स हुए। अगर आप नॉनवेज का सेवन करते हैं, अंडे का सफेद हिस्सा बहुत प्योर प्रोटीन माना जाता है। अगर मीट मछली आप खाते हैं तो उसको घर के बना के ले तो उससे बहुत फर्क पड़े। शुगर के पेशेंट में खासकर हमारे देश में देखा गया है कि कोलेस्ट्रॉल की प्रॉब्लम साथ चलती है। तो हमें तेल का सेवन कंट्रोल में रखना है, तले हुए चीज कम रखने हैं। तो कितना तेल का सेवन होना चाहिए, अगर सीधे शब्दों में देखें, आधा लीटर तेल प्रति व्यक्ति प्रति महीना। तो घर में अगर आप 4 लोग हैं तो राशन में 2 लीटर तेल आना चाहिए। इसमें सफेद तेल, सरसों का तेल, घी, बटर इत्यादि सब मिला के। अब तो काफी गाइडलाइंस आ गई है, बड़ा क्लियर है कि जो तेल घर के रूम टेम्परेचर में जम जाए, वो तेल आपके शरीर में, हृदय में भी जमने का चांस ज्यादा है। जैसे डालडा हुआ, घी हुआ, इसे सैचुरेटेड फैट कहा जाता है। इसका सेवन जितना कम किया जाए, इसके मुकाबले सरसों का तेल या ग्राउंड मूंगफली का तेल जो है, इसे ज्यादा अच्छा माना जाता है। तो एक मैसेज जाना चाहिए कि पूरे घर की रसोई की फूड हैबिट्स, सूर्यास्त जितनी जल्दी हो सके रात का भोजन निपटा ले। जितना लेट हम खाएंगे, हमारे शरीर को उस खाने को हजम करने में ज्यादा।
Yeah, I think some technical problem is there. So
Yes, yes. So I will summarize.
बढ़ के
I will
आएगी
summarize.
आपको रिसीव मोहन जी।
So it's good to hear from you, Dr. Deep, sir. I think you have summarized the discussion, and I will just try to bring it in English. For a healthy metabolism, what you should do is avoid the 4S. That is, skip the saturated and trans fat that clog the arteries. Dot the sugar, that is the second S, which spikes the insulin. And cut down the salty food, that is the third S. And the fourth S is the stress. So stress should be reduced as far as possible. And the final we have to control as giving simple steps. And that is what Dr. Deep has discussed today. Thank you very much, Dr. Deep, sir. So moving on, the next panelist who is here next is who will be it? Is none other than our own Shaila ma'am.
Dr. Shaila ma'am, Dr. Shaila Sheikh ma'am. So we know Dr. Shaila Sheikh ma'am is consultant endocrinologist at Safi Hospital and Reliance Hospital, Mumbai. She is principal investigating in the many international trials. So the number 35, so that is a very big number. She is member of Executive Committee of Endocrine Society of India, past treasurer of ESI, member of Scientific Committee of CAD. She got a lot of awards and author of many international books and also international HUS and diabetes guidance, IDF DAR guidelines 2021. So now, ma'am, welcome here on this platform.
Thanks, Sanjay.
So, ma'am, we know in diabetic patients, they have to face lot of challenges, and number of challenges they have to face. So regarding that only, could you elaborate the effective problem-solving strategy or best practice for common challenges faced by these diabetic individuals?
Okay, first of all, hi Sanjay, and thanks for having me over here. To be honest, Sanjay, मैं ना 2-3 tips दूंगी जो हम practically हमारे clinic में use करते हैं. It's a very, very practical approach. Because जैसा आपने बोले, as you said, patients do have day-to-day problems which they need to tackle at different levels. अभी फिलहाल everywhere in India, I'm assuming that it is going to be the wedding season. At least all my patients are coming to me, okay, madam, and I have a huge number of cards. Next 2 months is going to be pure wedding season everywhere. Problem patients अक्सर face करते हैं कि हम जाए तो मैडम क्या खाए, big issue कि हम जाए तो मैडम नहीं खाना ये तो मत बोलिए. तो हम उनको वेरी सिंपल टिप्स जो देते हैं संजय, एक तो हम हमेशा बोलते हैं कि बिकॉज आई पर्सनली बिलीव आल्सो एंड देयर इज लॉट्स ऑफ डेटा व्हिच शोज दैट जस्ट विजुअल क्यूज जो होते हैं ना खाने के संजय, जस्ट लुकिंग एट फूड मेक्स यू फील हैप्पी. Most of us, looking at good food makes you feel happy. It causes secretion of saliva, insulin secretion बढ़ जाता है. तो I always tell them कि आप जब फर्स्ट टाइम, जैसे कि आप जब बुफे को अप्रोच करते हो, तो कॉन्शियसली जितना खाना आपको चाहिए आपकी प्लेट में लीजिए एंड देन मूव अवे फ्रॉम देयर. ओके. और मोस्ट इंपॉर्टेंट थिंग, जब आप वो टाइम पे जाते हो तो हम सबको बोलते हैं कि प्रेफरेबली go to the counter which is serving more of roast food, and more of roasted food, more of salted food. आप वो पहले प्लेट में ले लीजिए, फिर कहीं जाके टेबल पे थोड़ा सा दूर आपके फ्रेंड्स के साथ गप्पे मारते मारते आप खाइए, आराम से खाइए. वेरी इंपॉर्टेंट. क्या होता है ना, सैटिस्फैक्शन सेंटर, for it to realize also it's full, by then almost 1,000 calories have gone in, Sanjay. So if you eat a little slowly, what we feel that it really helps patients control their sugars much better. That's one simple trick, because we try telling them to eat salad, Sanjay, and it doesn't work. मेरे patient बोलते हैं मैडम शादी में जाके तो आप प्लीज सलाद खाने मत बोलिए, वहां तो जाके हमको कुछ खाने दीजिए. तो ये थोड़ा सा प्रैक्टिकल वे डाइट को हम कोशिश करते हैं. और सेकेंड हम प्रैक्टिकल वे ट्राई कर रहे हैं डाइट को हैंडल करने की। संजय पोस्ट पैनल शुगर को हम सबको रिक्वेस्ट कर रहे हैं आजकल कि आप प्लीज घर में एटलीस्ट 5 से 10 मिनट वॉक करिए। 5 मिनट ही सही, तो एटलीस्ट 5 मिनट बोल के वो 10 मिनट हो जाता है जनरली, इट्स अ क्वेश्चन ऑफ स्टार्टिंग। और हम स्मॉल स्मॉल टिप्स देते हैं संजय, हम बहुत ज्यादा कॉम्प्लेक्स नहीं करते सिचुएशन को, जहाँ पे हम ये भी बोल रहे, ये भी बोल रहे, ये भी बोल रहे, ये भी बोल रहे, ताकि एंड तक मैं खुद भूल जाती हूँ कि मैंने क्या बोलने की कोशिश कर रही थी। तो हम छोटे छोटे चीजें बोलते हैं। हम मोस्ट इंपॉर्टेंटली क्या करते हैं ना, हम सबको रिक्वेस्ट करते हैं आप कुछ किस्म की डायरी रखिए। हमारे ऑल माई पेशेंट्स, माई 75-year-old uncle who comes to me and that small kid who comes to me, everybody is tech savvy nowadays. हमको लगता था कि अरे हमारे 70 years old अंकल जो आते हैं सालों से, उनको नहीं समझेगा। टिल रिसेंटली अंकल मुझे सिखा के गए कुछ कि बेटा ये नहीं ऐसा करो तो ये बेटर रहेगा आपके लिए ऑन द फोन। तो आई थिंक वी नीड टू अंडरस्टैंड, दे नीड टू हैव, यू डॉक्यूमेंट देम, टेल देम आप चेक करिए आप कितनी बार करते हो। अनलेस आप कुछ टारगेट रखो और चेक करो कि वो टारगेट पे आप पहुंचते हो कि नहीं, संजय इट्स ऑल वेरी देन ब्लर्ड। हमको पता नहीं क्या हो रहा है, पेशेंट को खुद को भी नहीं पता वो कितना कर पा रहा है। एंड सब हमारे जो कलीग्स है बिगनिंग से, अगर आप रियलाइज करो, एवरीबडी इज रिटरेटिंग कि यू नो इफ यू स्मॉल स्टेप्स, इफ यू कीप ऑन डूइंग देम, दैट्स व्हेन यू रीच गोल। सो इफ यू वांट टू रीच गोल, आई थिंक दिस इज द मोस्ट इंपॉर्टेंट थिंग। इफ आई हैव 1 minute more संजय, if I have 1 minute more संजय,
Yeah, sure, ma'am, sure.
1 minute more हम पेशेंट्स को ये भी बोलते संजय, आपकी रूटीन लाइफ में आप इसको इनकॉर्पोरेट करें। आप प्लीज जिम नहीं जाना है तो ऑफकोर्स जाइए, लेकिन अगर नहीं जा सकते, जैसे कि आप अगर A स्टेशन से B स्टेशन हाफ द वे अगर चल के जा सकते हो, जो आप आम जिंदगी में कर सकते हो, तो वो हैबिट बन जाती है। कुछ मतलब सिंपल चीज है, जैसे कि अगर आप हम ये नहीं, अगर 10 माले पे कोई रहता तो मैं 10 माला चढ़ने कभी नहीं बोलती, मैं बोलती 8 माले पे उतरो, 2 माले चढ़ो। दैट इज अ रीजनेबल वे टू फॉलो। हम ये भी बोलते हैं कि आप बस स्टॉप, बस हमारे बॉम्बे में तो बस है, बॉम्बे में बस हम बोलते हैं एक स्टॉप जो भी आप लेते हो उससे आप नेक्स्ट स्टॉप से बस ले लीजिए। तो मतलब आप फ्रेंड के साथ गप्पे भी मार लिए। जनरली while going back we tell them, while the patient is going for work, everybody is ruffled, we are running late, I know I'm running late all the time, and so you're all the time, so we try to tell them that okay, do it while going back so it's more relaxed. And the last very important message which I want to give Sanjay is, एक मिसकंसेप्ट जो बहुत लोगों को, एंड आई वांट टू यूज दिस प्लेटफॉर्म टू करेक्ट द मिसकंसेप्ट, इज दैट एलोपैथी मेडिसिन इज गोइंग टू स्पॉइल द एंड ऑर्गन्स। आज भी मुझे एक पेशेंट ने पूछा, बिलीव मी, और पेशेंट जिनको मैं जानती हूँ थोड़े दिन, मैडम मेरे को आज बाजू वाले ने बोला अरे आप ये खा रहे हो, किडनी को ही खराब कर देगा। अरे बाबा आपकी किडनी को। सो आई थिंक ये मिसकॉन्सेप्ट जो है ना, medicine is supposed to make you better, it is supposed to make you healthier, it helps you reach goal. On the contrary, diabetes, high sugars can cause all these problems. High sugars की वजह से ये problems हो सकते हैं कि एंड ऑर्गन्स, वो भी आप अगर कंट्रोल नहीं रखोगे तो प्रॉब्लम्स हो सकते हैं। तो आप मेडिसिन यूज करिए, डाइट यूज करिए। अगर मेडिसिन आप भूल जाते हैं तो आपकी स्पाउस को, आपके बच्चों को, आपके ग्रैंड बच्चों को, किसी को ही बोलिए आपको याद दिलाने के भाई मेडिसिन ले लीजिए। जैसे हम अक्सर बोलते हैं, अगर फॉर एग्जाम्पल डॉटर इन लॉ कम्स टू अस, संजय बोलते अरे पापा जी तो मेडिसिन ही नहीं खाते, तो हम बोलते बच्चों को होमवर्क कराते हो ना राजा, जैसे बच्चों को कराते हो उनको भी याद दिलाना। सेम चीज है, जैसे रोज पूछते हो उनको कि स्कूल में आप पढ़ाई किए कि नहीं, दादा उनको ही पूछ लीजिए अरे आपने दवाई खाई कि नहीं। सो इट वर्क्स आउट मच बेटर डेफिनेटली विद अ फैमिली इन्वॉल्व। Thanks for having me over here, Sanjay. It was a pleasure speaking to you.
Yeah, thank you. You have just explained such a common, in a patient language. You have just explained. You answered the question. So thank you very much. So
I had instructions from you, na Sanjay?
Yeah, me also. So same thing. Just Madam told regarding if we are saying something regarding diet. So only we are asking the patient how much you are eating, how you are eating. Only on that way we are explaining the patient. So one is very good thing that we are saying the patient you take a lot of this roasted food, or you take a lot of salad and fruits. Okay, so I used to explain the patient as we know the most of the population fruits are very expensive, it is not affordable for everyone. So I'm saying यार fruits बेवकूफ हो गया, fruits तो यार मैं भी नहीं खा सकता, इतने महंगे कहाँ से लेके आऊँगा, salad खाया करो, salad बहुत अच्छा होता है। Like that we are saying to the patients. So it's a very beautiful way. And regarding exercise also, whatever you can do only 5 minutes or 2 minutes you walk, that's better. So obviously we know 5 minutes nobody will walk. Once he will start at least 10 to 15 minutes he will walk. So this is a very beautiful way to explain the patient regarding that. Thank you, ma'am. Thank you very much. Now over to Mohan.
Yes, Thank you, ma'am. So I think next person in the panel is Dr. Saptarshi. So we can see the CV. Yeah, he's the senior consultant endocrinologist at Indraprastha Apollo, Delhi. So he's working in also Apollo Hospitals, Noida. He's ex-secretary of CEFIS. He's also executive committee of ESI as well as ITS and honorary secretary of Endocrine Society of Delhi. So Delhi wale aa gaye hai with around 100 publications in index journals. So he's the best person to talk about technology because he's using technology in daily life. And I want to know from you, Dr. Saptarshi, how can a diabetic patient living with diabetes, what the person क्या दिमाग में आना चाहिए, what are the technological innovations that are available for diabetes care, simplifying their lives? How can they do it themselves?
I think so, Mohan. It's a very important question. So diabetes is throwing us more and more new and challenging situations, and we are also trying to overcome that by finding out newer solutions. So, and thank God that we have technology to help us in our fight against diabetes. तो बहुत जरूरी है कि so there are multiple advancements. So you can say पहले we had to जब बहुत साल पहले it used to be urine glucose monitoring, then came CGMS. So now we then came glucometers, and we had to prick and then check. Now we have CGMS, which will give us information for 24 hours for 14 days, and now we have even sensors without pricks also, which can detect. So obviously glucose testing has improved. Now once we know that how your glucose is, how can we integrate with how much the body requires insulin? So we have a newer insulin pumps, which is like a closed loop artificial pancreas, where how much your sugar is can actually dictate how much insulin the pump is going to give. So this is about insulin sugar monitoring, insulin adjustment, insulin delivery, insulin pumps. So this is one aspect. And obviously in other way, if you're looking from the point of view of the patient, so there are apps, they will help you set targets, they will help you reach goals. There are remote monitors, you can get connected with doctors. There are several programs also which can help you in this. So you if somebody is not motivated, so you have some AI based AI based platforms which can actually help you do that. So things have changed totally. So as Dr. Sheila said, that we only think that the elderly won't be able to use it. So there are so many of our seniors in endocrine society itself were much better than me, at least. I'm not sure about Mohan. Mohan is obviously very, very tech savvy. But again, so one is the technological aspect of managing diabetes, understanding glucose, testing for complications, and even there are facial recognition apps there which can detect what is your chance of developing diabetes. So many other aspects also have come in. So it's a new era, it's an evolving era. So things are changing, and we hope that we are able to use the technology in the right way to overcome this huge challenge of diabetes.
Wonderfully summarized, sir. So I think you also touched upon the important aspect of diary. So they can keep the glucometer diary digitally. Also, it's possible. You can also chart the values for long-term control. After 1 year, maybe you can also see how you were previously. So you can backtrack and see. And complications can be screened. That is really important. Technology can help in complication screening. Retinopathy is also screened. Neuropathy is screened correctly. Urinary screening is also for nephropathy. So अभी बहुत अच्छा जमाना है. So people living with diabetes have a pleasure to live with diabetes, and it's actually better than previous times. But the cost of living is increased. The cost of using technology is also there. So we have to balance both. So इसीलिए I think the best mix is to meet your endocrinologist in your area who will guide you. That is the effort we are doing in this today's. Thank you, Dr. Saptarshi. So over to Dr. Sanjay Sharan for the next question.
For the next question, we have the Dr. Gagan Priya ma'am. So we know Dr. Gagan Priya ma'am is senior consultant endocrinologist at
CV is there.
Yeah, she is executive committee member of Endocrine Society of India. She has n number of awards, IGM awards for best reviewer, IGM awards for best article, Professor M.M. Ahuja Award, Fellowship Asia Pacific Pediatric Endocrine Society. So a lot of awards are there, a lot of journals are there, a lot of books also has written by ma'am. So now, ma'am, we know you are also a policy maker in Endocrine Society of India as you are executive committee member. So regarding that, I want to ask you now how the policymaker can enhance the care and well-being in the diabetic patients.
Yeah, thank you, Dr. Sanjay. I think a very, very important question. पहले समझने की जरूरत यह है कि डायबिटीज एक इंसान की प्रॉब्लम नहीं है, एक परिवार की भी प्रॉब्लम नहीं है, एक कंट्री की भी प्रॉब्लम नहीं है, ये ग्लोबल प्रॉब्लम हो चुकी है. एंड अगर हम पॉलिसी मेकर्स के एंगल से देखें, स्पेशली गवर्नमेंटल बॉडीज के एंगल से देखें, डायबिटीज इज द मोस्ट इन टर्म्स ऑफ हेल्थ केयर कॉस्ट सबसे ज्यादा बर्डन जो एक कंट्री पे आ रहा है इंटरनेशनली, वो डायबिटीज या उसके कॉम्प्लिकेशन से आ रहा है. सो इट इज वेरी इंपॉर्टेंट दैट government bodies as well as non-governmental bodies unite together and take action. अब क्या कर सकते हैं हम इस लेवल पे, इसको मैं दो पार्ट्स में डिवाइड करूंगी. One is with regard to detection and management and the second is with regards to prevention. अगर बीमारी के बारे में मालूम ही नहीं है तो एक्शन नहीं लिया जा सकता. एंड अगर आप फिगर्स देखें तो हर 100 में से 50 लोगों को मालूम ही नहीं है कि उनको डायबिटीज है. जिन 50 को मालूम है उनमें से 25 को ये नहीं मालूम है कि डायबिटीज से क्या कॉम्प्लिकेशंस हो सकते हैं, वो अवेयरनेस लैकिंग है. एंड बाकी के 25 में से आधे ट्रीटमेंट अपने टारगेट्स नहीं अचीव कर रहे हैं. So detection screening camps are very important and they should be done both through government and non-governmental bodies like us, our ESI, our SSTI, all of us need to join hands to improve the detection for diabetes. Awareness campaigns बहुत जरूरी हैं, because awareness नहीं है तो patient का वो knowledge, attitude, practices, वो practices पे तो हम पहुंचते ही नहीं है, knowledge ही नहीं है पहले. And the other is access to healthcare. That is a very, very important thing. Chronic बीमारी है. अभी 90% पेशेंट्स अपनी पॉकेट से दवाइयां लेते हैं या पॉकेट से टेस्ट कराते हैं. कोई इंसुलिन लगा रहा है, कोई शुगर टेस्टिंग कर रहा है. वी आर टॉकिंग ऑफ ऑल ऑफ दीज थिंग्स कि CGM लगा लो, ये कर लो. इवेंचुअली वो जेब से करना पड़ रहा है. सो एक्सेस टू मेडिकेशंस, एक्सेस टू टेस्टिंग, एक्सेस टू हेल्थ केयर फैसिलिटीज इज वेरी, वेरी इंपॉर्टेंट, जिसके लिए पॉलिसीज बननी चाहिए. In terms of detection, एक बहुत important part जो मैं emphasize करना चाहती हूँ, being a woman, I'm a very close, very strong anchor of women health. Gestational diabetes को एक national level पे program लेके जाने की जरूरत है, क्योंकि gestational diabetes आगे की जनरेशन्स की हेल्थ को भी इम्पैक्ट करती है. अगर मदर को जेस्टेशनल डायबिटीज है और वो अनट्रीटेड रहती है तो फ्यूचर प्रेगनेंसीज में भी और बच्चे में भी डायबिटीज होने का खतरा बहुत हाई है. सो दैट इज वन एस्पेक्ट. द अदर इज प्रिवेंशन ऑफ डायबिटीज. प्रिवेंशन ऑफ डायबिटीज के लिए ग्रास रूट लेवल से राइट फ्रॉम स्कूल एज हेल्थ एजुकेशन इम्पार्ट करना बहुत जरूरी है. हेल्थ अवेयरनेस कैंपेन जरूरी हैं, जो कि सिर्फ अगर मैं सोचूं मैं अपने क्लिनिक में अपने समाज में जाके 2-4 लेक्चर दे दूंगी उससे कुछ होगा नहीं. इसमें पॉलिसी चेंजेस, इवन फूड अवेलेबिलिटी के जरूरी हैं. वी आर सीइंग फास्ट फूड चेन्स ओपनिंग लाइक मशरूमिंग अप right in front of my housing society. There is a fast food joint जहां पे कम से कम 60-70 फास्ट फूड शॉप्स हैं, जो जिनमें से 10 24/7 ओपन है. लेकिन अगर फ्रूट्स का एक्सेस की बात करें, वो अवेलेबल नहीं है, अच्छी सब्जियां नहीं मिलती हैं. सो दीज पॉलिसी चेंजेस, कहाँ लाइसेंस देना है, किस चीज पे टैक्सेशन बढ़ाना है, ये बहुत जरूरी है. सोसाइटी में अक्सर वी टेल लेडीज आप वॉक करने चले जाओ, वी टेल ओल्ड पीपल वॉक करने चले जाओ, वॉकिंग स्पेसेस ही खत्म हो रहे हैं. सो अगेन सोशल एनवायरनमेंट को बिल्ड करना भी एक पॉलिसी मेकर्स की ही जरूरत है. एंड दिस हैज टू स्टार्ट फ्रॉम राइट फ्रॉम टॉप down to your local bodies, local municipal corporations, municipalities. They have to take these things into account. Yeah. So back to Mohan.
Yes, ma'am. So Sanjay ji, can I just pick next slide? Yeah.
Thank you, ma'am. Thank you very much. As you have beautifully just explained this answer, in which way the policymaker they can change the outcome of diabetes mellitus. Thank you. So now moving to the next question to Dr. R. Santosh. So we know Dr. R. Santosh is a very dynamic endocrinologist. He is consultant endocrinologist at Magna Center of Obesity, Diabetes and Endocrinology at Hyderabad. He is visiting consultant endocrinologist at Fernandez Hospital, Hyderabad, presented more than 1,000 scientific form. He is invited as a faculty speaker in 9 conferences on foreign soil. So we can understand how important is Dr. Santosh R for Endocrine Society of India. So now, sir, we know overcoming these obstacles and filling the gaps. So please tell the primary obstacles encountered by individuals with diabetes and how to overcome this.
So if you have to talk about obstacles, there are numerous obstacles. So I have decided to just enumerate a few of them. Otherwise, what I will be speaking will go on for hours together, actually. So one of the first obstacle which the patient says is inability to visit the doctors on time. That is mainly because of the distances that are involved or because of the time constraints that the patient is having because of the job pressure, etc. डॉक्टर साहब हर 3 महीने तो मैं नहीं आ पाता हूँ, मैं आपको HbA1c वगैरह कराना है, वो 3 महीने में मत बुलाओ, मुझे 6 महीने में बुलाओ, let that they'll tell. But HbA1c is a 3-month average blood sugar. You should be visiting your doctor once in 3 months. So what has happened after COVID? So COVID was, of course, a very bad thing to happen to the world. But what has happened is at that time, there is a legalization and there is a formulation by the government of India for teleconsultation. So whenever you meet your doctor personally for a visit, you always ask the doctor if you're able to follow up at least for once or twice on a teleconsultation so that you can get your tests done regularly at near your house and you can speak to the doctor at least once in 3 months. Make sure that you're meeting the doctor at least once in 6 to 9 months is what we are telling most of our patients, especially now people who are living in different states. Those people who are living in different countries, they are making use of the telemedicine concept very well. And we are able to control the blood sugars even in people who are living in small villages. So this is one obstacle which I feel has already been taken care by the government of India by legalizing telemedicine. So please ask your doctor whether he or she is available to consult once in 3 months online, and you can visit the doctor frequently otherwise. The second thing which patients are worried about is the escalating cost with the treatment. So again, the government of India has taken certain steps where generic medicines are also available in case you are not able to afford the medicines which actually are sold all over the world. So medicines, you remember, there are 3 types of medicines. So one is the originator molecule. Originator molecule is the one in which all the research has been done all over the world. They will be more costlier. Second is generic drugs with quality control, which have been now much cheaper in India. And there are many companies in India which are providing generic drugs with quality control. And there are some drugs which are available for even the lowest socioeconomic status, where perhaps quality control might not have been done, but they're available for larger consumption. Obviously, the originator molecules will be the most costlier one. The generic drugs with quality control will be less costlier and it will be good to the pockets of most people. And the generic drugs without quality control will be available and it will be very cheap for most people. That is called as Jan Aushadhi actually. The other thing that patients are very much confused about is the amount of knowledge that is now available on social media regarding diabetes. So this has become a significant obstacle nowadays in the management of diabetes. They don't know whom to believe, what to, because they are hearing sensational news on social media about diabetes reversal and some fat diets, etc. So whenever you are hearing something on social media, I will urge my patients ki पहला देखिए कि authentic है कि नहीं ये information. So who is the person who is giving this information? Is he or she qualified in the field of endocrinology or diabetes and is able to procure this give this information? Number 2, please be aware of sensationalization of news. If somebody is coming online and telling कि ये सारे चीज बकवास है, ये चीजें करिए और अगले दिन आपका डायबिटीज ठीक हो जाएगा, अगले दिन आप डायबिटीज रिवर्स हो जाएगा, आप गुलाब जामुन आइसक्रीम सब खा सकते हैं, ऐसे सब न्यूज आ रहा है एक्चुअली सोशल मीडिया में. सो बी अवेयर ऑफ पीपल हु आर सेंसेशनलाइजिंग थिंग ऑन सोशल मीडिया. टेक अ पॉज, discuss these things with your doctor or who will in the best evidence will guide you properly. The I will see another obstacle that we Indian doctors face in the management of diabetes. So we're not talking about patients here, is the time that is available that we are able to give to each patient. So in India, as you know, the number of patients are very high for an individual doctor. There are most people on and a established endocrinologist after 10 to 11 years will be obviously seeing 40 to 50 patients in a day. So how the doctor can improve the time spent with the patient and how can we give a comprehensive treatment is another challenge or an obstacle which are from the healthcare point of view. So nowadays, there is more and more focus by most endocrinologists to do comprehensive care, where the stuff that can be done by people outside your room, like for example, taking down the history, checking the blood pressure, checking the pulse rate, and taking down your basic drug history, can be done by somebody else. After that, the doctor can concentrate on giving the key information which can be given in the 7 to 10 minutes that are allotted to the patient, after which the patient leaves and we have a group of diabetes educators and dietitians who then take over and make sure that all the information that the patient needs to know regarding his or her illness is given at a time. So comprehensive health management is now becoming more and more common practice with diabetes, and that obstacle is also being taken care of. The last thing that I would like to discuss among all the problems that I spoke about is polypharmacy. तो डॉक्टर दवाइयाँ बहुत ज्यादा हो जा रहे हैं यार, ये आप पेन किलर भी दे रहे हैं, आप बीपी का दवाई भी दे रहे हैं, कोलेस्ट्रॉल का भी दे रहे हैं, शुगर का भी दे रहे हैं, फिर हार्ट को प्रोटेक्ट करने के लिए भी दे रहे हैं. So please remember that again, India is a country which is allowing combination therapy for most drugs. So if you feel that your drugs are becoming too many, please talk to your doctor about that, and whether the drugs that you're using can be combined in combination pills so that the number of drugs go down and you will be able to control your blood sugar better. In other countries, for example, in the US and Dubai, etc., they don't have combination. So if you have diabetes, they are much worse than what you are. So if you are worried about polypharmacy, please reach out to your doctor and ask whether you can be given combinations which are approved by the drug controller of India, and that will make your life more simpler and better.
Thank you, Dr. Santosh, for beautifully explaining these obstacles and how to overcome with them. In fact, once the patient will listen you, obviously he will overcome all the obstacles. In this beautiful way, you had just told the legal way and these all things in this beautiful way. So now over to Mohan.
Yes, Sanjay. So that brings me to the most important last question. To deal with this question, we have got an expert, Dr. V. C. Nagesh, sir. He is working in Hyderabad in C. Nagesh Diabetes, Thyroid and Endocrine Center. And he has won the YR Reddy Gold Medal, as well as also we are AR Sheth, AV Sheth. So he has a lot of publications. Anil R. Sheth Award in 2017 at Esicon Trivandrum. He's a principal investigator of National DSA Registry, as well as he has got a huge area of interest. He's a walking encyclopedia in endocrinology in India. And welcome, sir, for joining. Thank you for joining today. And I want to ask you an important question.
Yeah,
so
please tell
today is actually the Children's Day, which is in India. And I was informed by you yourself that it is not so all over because International Children's Day is different, but the childhood diabetes is also increasing.
Yes.
So are you finding it as a important reason why diabetes is also having more roots globally because number of diabetes increasing because childhood diabetes is also increasing? And how do you find the diversity of diabetes? Because I think even type 1, type 2, difficult to distinguish because young onset diabetes is also there. You have done so much research on this. For our population, it's basically a patient question which we ask, we get questions. How do you feel that this is happening? And what can we do?
Mohan, that's a very important and apt question you asked me today, especially on the Indian Children's Day and International Diabetes Day. As far as the prevalence of diabetes and the incidence of diabetes worldwide it is increasing, and the same holds true even for children. A lot of times in the OP, we are faced with one question. Are we dealing with, is this type 1 or type 2? लोग यही पूछते हैं कि डॉक्टर साहब मुझे शायद आपको टाइप 1 डायबिटीज है या टाइप 2 डायबिटीज है. For many years, the generally held assumption was that any diabetes which was seen in children was type 1 diabetes. By default, the children were started on insulin, and later on, for the rest of their life, many of these people actually continued on insulin. But in the last 20 years, as research has increased, we have discovered that type 1 diabetes is not the only type of diabetes which happens in children. ऐसे सिर्फ बच्चों में सिर्फ type 1 diabetes ही नहीं होती है, ऐसे और भी कई types of diabetes है जो बच्चों में हो सकते हैं. सबसे important, especially after the lockdown, with a lot of children sitting at home, obesity increasing, inactivity increasing, we've actually seen a jump in the number of children who are presenting with type 2 diabetes. And in the last 2 decades, जैसे as we have increased our understanding of genetics, we have discovered a new type of diabetes which is even seen in children, which is seen in adults, which can even be seen in babies as young as 2 or 3 days of life. I have done a significant amount of work in this, something known as neonatal diabetes.
Yes.
ये एक आनुवंशिक काइंड ऑफ डायबिटीज है. दिस इज ए जनरेशनल डायबिटीज विच इज इनहेरिटेड, जो किसी भी उम्र में आ सकता है, और जो टाइप 1 डायबिटीज है ना टाइप 2 डायबिटीज है. ये डायबिटीज हम दूसरे चीजों से डिफरेंशिएट कर सकते हैं. जहाँ एज ऑफ ये बच्चे बहुत ओबीस नहीं रहते, जनरली ब्रॉडली क्लासिफाइड type 1 diabetes children will present with very high blood glucose levels. Many a time they will present with an emergency situation known as diabetic ketoacidosis, where urine ketones will be positive. They will have rapid respiration. The 3 months average, which is HbA1c, will be somewhere to the tune of 11 to 12%, always over 10%. The blood glucose levels will be 400 and above. A lot of these times, these children will need hospitalization. They will need initial IV insulin therapy, and once they are stabilized, we start them on insulin, and they are continued on this for life. Unlike this, when children generally present with type 2 diabetes, which still now even in India thankfully is not all that common. Western countries में बहुत common है, but India में आजकल ये पिकअप हो रहा है. ये बच्चे हमेशा वजन ज्यादा होते हैं. These children tend to be obese. गर्दन पे ये एरिया पे पीछे से आगे तक they have something known as acanthosis nigricans, कालापन होता है. They have small skin tags. Many of them will present with a strong family history of diabetes, especially type 2 diabetes. Type 1 diabetes families में उतना common नहीं है. Type 2 diabetes is more common. There is always a familial pattern with type 2 diabetes, and children almost invariably tend to be obese. But in दोनों से लेके a third type of special diabetes which is commonly seen in children is monogenic diabetes. This is approximately present in around 5% of the population. Can happen at any age, right from the 2nd or 3rd day of life till you are 90 years old. This is usually, many of these are milder than type 1 diabetes and type 2 diabetes, and they present with classic features. Children are usually not obese, though they can be obese, but it's less common. Presentation is with much lesser blood glucose levels. They tend to have good insulin secretion, and what is important, the reason why we need to focus on these special types of diabetes in children is the fact that many of them can be switched over to oral medication. It's not mandatory that they should be always started on insulin. But to know what kind of diabetes a child has, we have to be aware of the different types of diabetes, know which child fits into which criteria as far as diabetes is concerned, and order the appropriate tests, including antibodies for type 1 diabetes. Look at other markers of insulin resistance like dyslipidemia or the high hsCRP levels. And in almost all cases of this monogenic or neonatal diabetes, the diagnosis is usually only by genetic testing, which has become very cheap. ये कोविड से पहले आपको सब जगह ये जेनेटिक टेस्ट नहीं मिलते थे, उसका खर्चा भी बहुत ज्यादा होता था. जब से कोविड के लिए हमने जेनेटिक टेस्ट स्टार्ट करना शुरू कर दिए, ये इक्विपमेंट का कॉस्ट भी बहुत कम हो गया है और टेस्ट का कॉस्ट भी बहुत कम हो गया है. और अभी आपको 10-15 हजार के अंदर आपको डायग्नोसिस हो सकता है, और these things are totally worked up as far as the genetics are concerned. आप जेनेटिक्स देख के कौन सा जीन से फ्यूचर में बीमारी कैसे हो सकती है, किस तरीके से शुगर बढ़ सकती है, और किस दवा के साथ ये कंट्रोल हो सकती है, और आगे क्या कॉम्प्लिकेशंस हो सकते हैं, फ्यूचर में शादी करने के बाद क्या प्रॉब्लम्स हो सकते हैं, ये सब भी आप डिस्कस करके ट्रीटमेंट कर सकते हैं. ये मैं नहीं ये बोल रहा हूं कि आई एम नॉट सेइंग दैट मोनोजेनिक डायबिटीज प्रेवलेंस हैज इंक्रीज्ड. द प्रेवलेंस हैज रिमेन्ड द सेम, but we are discovering better methods of detecting this monogenic diabetes. Awareness about monogenic diabetes has gone up, and so we are picking up more cases. But coming back to type 1 and type 2 diabetes, the prevalence is definitely increasing for both type 1 and type 2 diabetes. Even type 1 diabetes children can be obese. There is more influence of chemicals known as endocrine disruptors, which are known to have a marked effect on both type 1 and type 2 diabetes. And prevalence of type 1 diabetes the very catastrophic form of diabetes is definitely increasing at a slow rate, but it is increasing in India. And we have to understand that India is the country with the largest population of type 1 diabetes children. तो इसीलिए ये हमारा फर्ज बनता है कि जिन बच्चों को भी टाइप 1 डायबिटीज है उन्हें सही मात्रा से, जैसे मेरे पहले स्पीकर्स जो मुझसे पहले बात करे थे, उन्होंने बोले थे सही मात्रा में एजुकेशन दे, उनको चीपर फॉर्म्स ऑफ इंसुलिन के बारे में जानकारी दे, उनको ऐसे गवर्नमेंट ऑर्गेनाइजेशंस के साथ या एनजीओस के साथ डायरेक्ट करे जो इन लोगों को मुफ्त में इंसुलिन या कभी कभी जरूरत पड़े तो इंसुलिन पंप्स का भी सप्लाई कर सकते हैं, और स्कूल्स में, कॉलेजेस में और दूसरे उनके सहपाठियों छात्रों के को भी इस टाइप 1 डायबिटीज के बारे में अवेयरनेस दे सके, so that these people don't generally feel socially ostracized and they can have a normal life which is seen with others, which is enjoyed by the other children. As far as type 2 diabetes is concerned, even the prevalence of this is increasing because of the rise in obesity. But the importance of detecting and treating type 2 diabetes early is, to a great extent, we can have a remission. I don't condone the word reversal of diabetes. Reversal कॉमन तरीके पे डायबिटीज में नहीं होता है. रिवर्सल का मतलब है कि ये चला जाता है और जिंदगी में दोबारा वापस नहीं आएगा. ऐसा तो कभी भी रिवर्सल नहीं होता है. जो भी रिवर्सल का शब्द इस्तेमाल कर रहे हैं वो गलत इस्तेमाल कर रहे हैं रिवर्सल शब्द का. इन बच्चों में सिर्फ रेमिशन हो सकता है, यानी जैसा वजन घटती है, जैसे बच्चों में डायबिटीज कम होते होते धीरे धीरे आ जाती है और वो बिना दवा के भी काम कर सकते हैं. पर जब भी दोबारा लाइफस्टाइल खराब हो जाती है और बच्चे वापस वेट गेन करना शुरू कर देते हैं, फिर इन बच्चों में डायबिटीज वापस आ सकती है. तो it is our responsibility to ensure that these children are picked up early. If needed and if the blood glucose levels are high, start them on preliminary treatment. But most important, focus on the lifestyle and physical activity. Cut down their, ask them to help them improve their lifestyle, cut down their weight so that they go into remission. And most important, it is up to us to ensure that these children are maintained in remission. A healthy lifestyle has to be inculcated and this lifestyle has to be maintained for life. And that is the reason why we don't give a lot of emphasis on fat diets like the keto diet or the paleo diet, because these are not sustainable in the long term. ज्यादा दिन तक आप कुछ भी पेलियो डाइट या कीटो डाइट या एटकिंस डाइट वैसा कुछ भी डाइट करेंगे या इंटरमिटेंट फास्टिंग करेंगे, आप थोड़े महीने, 2 महीने 3 महीने तक मेंटेन कर सकते हैं. उसके बाद तो आप मेंटेन नहीं कर सकते. और इन डाइट्स के वजह से बॉडी पे जो लॉन्ग टर्म साइड इफेक्ट्स हो सकते हैं वो क्या है हमें अभी तक मालूम नहीं है. तो इसीलिए हम हमेशा बच्चों पे ये ध्यान देते हैं कि ये डाइट सस्टेनेबल हो, प्रैक्टिकल हो और लॉन्ग टर्म के लिए ये लाइफस्टाइल ही चेंज करेगा. डायबिटीज को बच्चों में बढ़ने से रोकने के तरीके 2-3 ही है. एक, टाइप 1 डायबिटीज सही टाइम पे देखे, पहचाने, उसको सही ट्रीटमेंट जो इंसुलिन है वो दे. दूसरा, टाइप 2 डायबिटीज जो है सही लाइफस्टाइल टाइम पे इनकलकेट करे और ये टेक केयर करे कि बच्चा दोबारा वजन नहीं बढ़ेगा. और तीसरे, जो मोनोजेनिक है नियोनेटल डायबिटीज है, उसका एक ही इलाज है कि सही टाइम पे रिकॉग्नाइज करे, जेनेटिक टेस्ट करे और उसका जो भी सही ट्रीटमेंट है जेनेटिक रिपोर्ट के हिसाब से उस टाइप में हमें ट्रीट करें. ये करेंगे तो एटलीस्ट टाइप 1 बच्चों में डायबिटीज बढ़ेगा या नहीं बढ़ेगा, एटलीस्ट सही तरीके से उसका हम कंट्रोल तो कर सकते हैं.
Thank you, sir. So that is a wonderful summary. I think we already had discussed. So India is becoming a huge area where it's actually, I heard that it is a highest number of type 1 diabetes. And actually it is going to increase if we are not screening them, because once they develop into adulthood, they already must have lost their beta cells. So it's a good that we have discussions on this with the schools, the policymakers, the community, the caregivers, the family members, as well as teachers or anybody who is concerned with type 1. And as you were told, the lab also, the proper genetic test is done. You can definitely screen them and live a healthier life with diabetes. So diabetes का डरने की जरूरत नहीं है. इलाज है, थोड़ा महंगा हो सकता है, but बाद में you will know that complications also will come down and definitely quality of life is also improved. So thank you, Sinagesh sir. So अभी हमारे पास वक्त कम है, but I would like to ask each of the panelists in the reverse order any take-home message which you would like to give our audience. Starting with you, Dr. Sinagesh sir.
So my take-home message has only remained the same. Focusing on care of type 2, care of identification of the correct kind of diabetes, institution of the proper treatment, and most important, education of the parent is mandatory as far as children is concerned, because children can't take care of themselves. Parents have to be aware of this. Don't go after alternative therapies. Make sure that you are in regular discussion with your doctor.
Thank you, sir. What about Dr. Santosh sir? One take-home message from you, sir. One short take-home message from you, sir. Yeah.
Yeah. So as I said, diabetes is a very complicated condition, and there are numerous people who have now used the complicated nature of the conditions to sensationalize themselves on social media. As if I have to give one take home message is, if you are looking at the social media, please verify the credentials of the person who is giving it, and don't fall for sensationalized stuff like reversal of diabetes, which can occur overnight. And don't listen to your doctor. Doctors are fooling you, etc., etc. Somebody is talking like this, please cut off or just don't stop following that, because many people are falling into the traps of
Influencer doctors.
influencers.
Thank you, sir. What about your doctor, Gagan Priya ma'am? One small.
Yeah, Mohan. So I was giving a public lecture in my hospital today, and some old patient of mine reminded to, I was not talking about this dhol and bhangra concept. So if we talk about the problem in India, we have dhol, diabetes, hypertension, obesity, lipid disorder.
Okay.
और being a Punjabi, जब ढोल बजता है, we want to do bhangra.
Bhangra. Yes, yes.
So what was bhangra? Behavior change. We have to change our behavior towards a healthy lifestyle. Happiness is important. We heard earlier about stress management. Problems life में आएंगी, diabetes भी challenge लगेगा, लेकिन हमें अपने आप को change करके stress management की तरफ जाना है. Then A stands for active lifestyle. Just like Sheila said earlier, कि 10 मिनट चलो, 10 मिनट multiple time चलो. Active lifestyle helps. Nutrition helps. We heard from Deep earlier. Then is G stands for glucose control. Obviously, medicines के साथ glucose control करना है. R stands for risk reduction. सिर्फ डायबिटीज या ग्लूकोज कंट्रोल से सोल्यूशन नहीं होगा. कंट्रोलिंग हाइपरटेंशन, ब्लड प्रेशर, लिपिड्स, everything is important. And the last, of course, A stands for abstinence from abuse. So we see abuse of smoking, drinking, opium, अफीम यहाँ हमारे बेल्ट में कॉमन है. So all of these things. So जब ढोल बजता है, the message is do bhangra.
Yes, yes. Thank you, ma'am. So we have got Dr. Shaila Sheikh, ma'am. Your take-home message, ma'am.
Most
Shaila, ma'am?
importantly, Mohan, prioritize yourself, prioritize your health, because if you are fine, as Gagan said, it's you, your family, society, globally, everybody stays fine. So I think it's very important that each and every person also takes, it's not only the doctor's responsibility to look after diabetes. It's every person who is not only a diabetic, who's even a non-diabetic, to help each other and see to it that we all live a happier and healthier life.
Thank you, ma'am. So we have got some more time. Dr. Deepdatta, sir, one last take-home message from you, sir.
एक मैसेज सभी श्रोताओं के लिए है कि मधुमेह शुगर से हारे नहीं, इससे हम जीत सकते हैं. खेले कूदे, एक्टिव रहे और खान पान में कंट्रोल रखें. ये खान पान रहन सहन की बीमारी है, बीमारी नहीं है. एक लाइफस्टाइल थोड़ा चेंज करना पड़ेगा तो हम इसको आराम से जीत सकते हैं. दवाइयाँ हैं, अच्छी दवाइयाँ हैं. अपने डॉक्टर से मिले और सही दवाई उपयुक्त मात्रा में ले, ना कम ले ना ज्यादा ले, उपयुक्त मात्रा में ले.
Thank you, sir. So we have got last, I think we have got Dr. Sanjay Barada, sir. Your take-home message, sir. While Barada sir is online, may I request Dr. Kaushik Pandit, sir, to please give his take-home message, sir.
We had a very fruitful discussion all through, and I would request people who are affected with diabetes, do not lose hope. It is always possible to win over diabetes, as Dr. Deepdatta had said. And one particular result which is off target might not dissuade you. There are options to improve your situation. Help is at hand. Even Endocrine Society of India is always helping to get to a better target, to a better glucose control, to a better diabetes outcome. Thank you very much.
Thank you, sir. The last person is, of course, our own Sanjay Sharanji. Your message, and as well as KVS Hari, sir. So both of you, please help us with completing the session also. KVS, sir, first, your take-home message, sir, from today. What have we learned today, sir?
Only thing, thanks for the excellent conduct. But two statements I'll say. One is, take care of your diabetes. Diabetes will take care of you. Never neglect it, will not neglect you. Second thing, most of the times patients say मेरा sugar कभी control ही नहीं होता है. There are only three reasons: either the patient is bad, doctor is bad, or both are bad. So the only thing is, if the sugar is not controlled and you want it to be controlled, see a concerned who is willing to help you. I am sure no sugar goes uncontrolled. You can lead a happy, healthy life, provided you are in the right hands. That's all.
Yes, that I will really thank you for all of you. And also, I want to thank my co-host or co-moderator, Dr. Sanjay Sharan, for being so tolerant and so expressive, and also so much information which you have learned today. One message from you, Dr. Sanjay Sharanji.
Yeah, for on this Diabetes Day, I would like to say only to the patient, just change your lifestyle. This is the lifestyle disease. If we'll change the lifestyle, we will definitely overcome the disease. Do not afraid with the disease, just face the disease and change your lifestyle. So this is my take-home message on this Diabetes Day.
Thank you. So I think that brings us, every good thing has to come to an end. And it is sad that we definitely want to end it on a good note. And as I thank all of you for joining today, let me also thank the President of ESI, Kotwal sir, the past President, Dr. Jabbar, then Dr. Sanjay Barada sir for joining us today, as well as the President-elect, Dr. Sangshu Pandit sir, for spending time today and discussing important questions. Let me also thank the ESI Secretary, Dr. KVS Hari sir, ESI Joint Secretary, Dr. Deep Datta sir, as well as Dr. Shaila ma'am, Dr. Saptrishi sir, Dr. Gagan Priya ma'am, Dr. Santosh, Dr. C. Nagesh sir, as well as Dr. Sanjay Sharan for having designed such a beautiful program, as well as the technical team, because success of the technical team is also beautiful. They have designed the flyer, they have also helped us with the background, and also they ensured a hassle-free conduct of this program. And also we are available to you on the YouTube channel as well as the Facebook page. So I request you all in the public to please subscribe our pages and let us do a lot of good things together. So let us sign off. Thank you. Have a nice day. Good night.
Thank you. Good night.
Thank you.
Thank you, Mohan. Thank you, Sanjay.
Can we just stop recording so that we can take a photo? Yeah.
Thank you.
Can you just stop recording, technical team?
Yes, sir. Yes, sir. It's done, sir.
Recording is not stopped. Yeah, can you stop the recording? Yeah. Done? So we'll take a photo and before you go. Last photo.
I think they're asking for a group picture, right?
Yeah, that's what I was telling them. Can you take a technical team? Can you just make a multi-speaker or gallery view? Yeah, gallery view I've taken. So I will take a photo now. Can you just put your cameras on, Dr. Deep sir, Sanjay sir?
Yeah.
Sanjay Barada sir. Yeah. So we'll take a photo. Last one. 1 second. I'll do it. I'm doing it here.
Barada sir has not started yet, I think.
Yeah, but maybe he's gone for a dinner. It's already late.
Yeah.
So we'll take a photo now. Hi, Dr. Sham, Mrs. Sham. 1 second. 1, 2. I'll time it. 1, 2, 3. Done. I'm done.
Okay. Thank you. Good night,
Thank you so
everybody.
much.
Thank
Bye.
you.
Thank you, sir.
Good night.
Thank you, Sham.
Thank
you.
Deep was in the photo.
Good night to all. Very good night. Thank you.
I hope it was good. Night. Thank you, Sharon. Thank you, Nagesh sir.